Well, first and foremost, a huge thank you to the WHO Foundation for bringing together such an exciting group of private sector actors that included not just traditional tech actors, but also some of the health tech innovators that are working in this space, as that's a rare group of folks to bring together. What was fascinating about the conversation is that it really focused on, one, how the WHO, through their digital health and innovation team, is really changing the perspective around the role of the private sector and finding new models of engagement, and two, pushing the boundaries of partnerships. Both Derek and Andy did a fantastic job highlighting the breadth of the partnerships that they have already in place with different private sector actors and how that's really exploded since the COVID-19 pandemic.
Well, it's been a very exciting event on a cloudy day, but there was a lot of light and sparkles in the room. I think what has come out for me is the power of partnership. Somebody said we cannot do it alone, and in order to change the world, to make this digital transformation a reality in the countries, a reality that is equitable, we really need to work together. And it was wonderful to have the private sector together with the WHO, and the exchange of what the WHO is doing and what WHO could do even more with the support and in partnership with the private sector is what stood out for me. The other element that really hit me was the sense of urgency that I felt.
Our work involves building the enabling environment through the global strategy on digital health, and the enabling environment is really people skills. It's really the digital solutions needed to inform the transformation of the health sector. It's really about partnership, and so we are positioned to deliver on the transformation on behalf of our member states through three key pillars: people skills, the processes needed for the technology to exist, and also the availability of the appropriate technology to lead or influence the transformation of the digital health agenda itself. Our backbone is a global strategy on digital health, and we're thrilled to be able to nip this strategy within the Global Digital Health Compact and the Pact for the Future that has just been agreed by the world leaders as we look towards the 2030 agenda.
I thought the event today was really mind-opening for me. I learned a lot about the new ways WHO is working to get people to move around, improving their own health or getting them the right information around health in different digital channels. This was really new for me. And I love that because this is the way people get to information nowadays. So that was one learning. The other one is definitely that there's such an increased openness to partner with the private sector, which is also music to my ears, because I believe if we want the world to get to better health, we need to work together. All these problems we face nowadays, they are far too large to handle by one partner alone. And WHO is so well placed to reach all of the world. So if we as private sector players can contribute a little bit to that, we are more than happy.
So I'm hoping that the fantastic partnerships that were highlighted over the course of the conversation can inspire new partnerships for those that are already deeply engaged with the WHO and those that are sitting on the sidelines and trying to find new models for engagement. My other hope is that the Digital Health and Innovation team, through their innovative thinking around private sector partnerships, can change the mindset within WHO more broadly so that different groups in WHO start to see the value of the private sector and find new models to bring them in and truly partner with them to achieve health and well-being for all.